meeting to order. Roll call, please.
Legislator Halfway.
I'm here.
Legislator Merkler. Here. Legislator Burns.
Yes.
Legislator Gilbert.
Here.
Legislator Chartrand.
Here.
Legislator Morahan.
Here.
Legislator Kulzer.
Here.
Legislator Osborne.
Here.
Legislator King.
Here.
Legislator Dahlhoff.
Here. Please stand for the invocation. Father, as always, we appreciate the blessings you bestow upon us. Many of them we don't even realize, and many of them we don't thank you for, but all of them we appreciate. And we thank you for guiding us along. And Father, we wish you'd reach down and touch those citizens in our county in need, and help us to be able to help them as well. And I wish you'd help us have a country together like we are in Lewis County. Guide us with our decisions today, and be with us all, please. Amen. Raise the flag for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The June 22nd and July 6th board meeting notes have been distributed, and if there are no amendments, they stand approved. Hearing none. Report of the Finance and Rules Committee for Rule 6. Cassandra, please.
Thank you, Mr. Chairman. The Finance and Rules Committee has met, and they recommend to waive rules to act upon late resolutions.
Need a motion? Ron, second by Dick. Discussion? All in favor? Aye. Anyone opposed? Carries. Privilege of the floor. Is there anyone here that would like to address the board with comments from the floor? We'll leave that open for now and move on to presentation of petitions, communications, and notices. Cassandra?
Thank you, Mr. Chairman. Franklin, Livingston, and Orleans County all submitted adopted resolutions calling on Governor Cuomo to complete Affordable Care Act enhanced federal Medicaid assistance percentage reconciliations that are years overdue and immediately release the federal funds owed to counties and New York City. The following letter was received from Ms. Vicki Roy. As a Lewis County taxpayer, I would like to express my concern in regard to the county's consideration in building and owning a structure and leasing it. I do not see why the county should use taxpayers' dollars to invest in a building for a nonprofit business. When you say number 3 wind farm payment in lieu of tax monies would be used, that is still tax revenue to be utilized to help offset county expenses. And if I am reading the article in the Journal correctly, you would also be entering into a bond debt. I'm sorry, but this does not seem fiscally responsible. It appears that county would be taking a great risk with no sure return for our money. Additionally, I do not see where the entire county would benefit from a community center in the village of Lava. I am sure there are many more important challenges the county has to face. If they don't feel they need the in lieu of payment, they can use it to reduce the tax levy. In my opinion, that would help all taxpayers far more than a community center in Lava. I know that in the town of Watson, many of our residents are facing a large debt for the water district, and any help they could get would be appreciated. If Mr. Myers feels it is a profitable endeavor, then he should be looking at other resources, as I see he has. However, I do not see the taxpayers as a reasonable source. Thank you for allowing me to voice my opinion. Sincerely, Vicki A. Roy. That concludes my report.
Thank you. Reports of county officers and departments.
Thank you, Mr. Chairman. Legislators received the monthly treasurer's report and highway and solid waste July audit reports. Real Property Director Candy Aiken and County Treasurer Eric Herkler have filed approved applications for refunds or credit of real property taxes for property owners Lauren and Debbie Zaire. And Brian Mooney submitted the June and July 2021 sealer of weights and measures activity reports, which have been placed on file with the clerk of the board. That concludes my report.
Thank you. Reports of standing committees. Tom, would you start off with financial rules, please?
Thank you, Mr. Chairman. I got two motions. I'd like to make a motion to continue the Lewis County procurement policy as presently in place, including continuation of the county manager and chairman of the board identified as responsible purchaser and alternate responsible purchaser, respectively, in compliance with the general municipal law of 104B2F. I'll make that a motion.
Moved by Tom, second by Ron. Discussion. All in favor?
Aye.
Anyone opposed? Carries.
And I'd like to make a second motion to authorize clerk of the board, Cassandra Moser, to refill one full-time deputy clerk of the board position effective immediately due to resignation.
Moved by Tom, second by Phil. Discussion. All in favor?
Aye.
Anyone opposed? Carries.
And that's all I have this time, Mr. Chairman.
Any questions for Tom? Thank you, Tom. Jerry, General Services Committee.
Thank you, Mr. Chairman. I have one motion to make. Motion to authorize Clerk of the Board Cassandra Moser to publish an advertisement in the Watertown Daily Times to fill vacancies on Lewis County Junkyard Review Board. No.
Moved by Jerry, second by Ron. Discussion. All in favor?
Aye.
Anyone opposed? Carries.
That's all I have, Mr. Chairman.
Anyone have questions for Jerry? Thank you, Jerry. We'll move on to Andrea, Health and Human Services Committee.
Thank you, Mr. Chairman. I have a motion. The motion is to authorize Public Health Director Ashley Wade to refill one full-time public health nurse position effective immediately due to resignation.
Moved by Andrea, second by Dick. Discussion. All in favor?
Aye.
Anyone opposed? Carries.
And that's all I have, Mr. Chairman. Thank you.
Anyone have questions for Andrea? Thank you, Andrea. If we'll move on to Dick, board rep on the Hospital Board of Managers.
For July and August, we aren't having our meetings for the board meeting. We're having our committee meetings like we have here. So I'd like to yield my time to Jerry because I think he's got a couple things probably he'd like to address with us. Maybe an update on the COVID issue would be well, Jerry.
I'm sorry.
An update on the COVID.
The one, two items. The first is we received CON approval for the hospital project, which, if you remember, was the revitalization of med-surg and ICU and the construction of the surgical pavilion, which is we will relocate the OR along with our specialty practices so they're in the same structure. So at this point in the process, the actual certificate of need and all the approvals are in the bureaucracy in Albany receiving signatures. That's a few-week process before we receive that. Earlier today, our CFO, Jeff Hellinger, Ryan Pichet, the county manager, and Eric Berkler, the treasurer, we gathered, and Joan McNichol gathered with the individuals who will help us with the bond process. And so we are initiating that. And on the 17th of the month, the project team will come together as we map out the dates that'll get us to the bid process. And we will initiate the bid probably around Thanksgiving time. And then 6 weeks later, we'll make a decision. Probably the only concern I have at this point is the interruption to the supply chain. And all of our estimates for this project were pre-COVID. And as you know, supply chain and materials have gone up dramatically. So we still have some work before us. The COVID response continues. In the short term, we have shut down, as you heard last month, the screening clinic at the Maple Ridge. we are working, Mr. Pache and Mrs. Waite are working through a process where we will be able to reactivate that. We had a contract with the state that was going to conclude September 30th, but once the emergency was lifted by the governor, the contract was eliminated nearly immediately within 2 weeks. That's problematic because right now we are unable to do community screening. And if you remember, there was no cost for that, and it really was a good indication of what was happening within our county. So our goal is to begin in the next week or so, and you will have some discussion about that later this evening, and I'll be here to assist in any way I can. The other part around COVID that's troubling me at this point is the whole conversation around masks, and I know you will probably have some conversation around that tonight. I brought some materials for you. We are seeing an increase in COVID activity. We have seen an increase in hospitalizations, and we have lost some staff. So we continue daily, from a health system perspective, to deal with this issue. And with the last wave, we did not impact services with the exception of elective surgeries, which was directed by the DOH. But we are at a stage now, after about 20 months of intense COVID activity, of dealing with the effects of burnout, individuals deciding they no longer want to be part of healthcare, and some real challenges around recruiting. And this past weekend we had a number of COVID admissions, and so it is here, it is real. In our organization, we've never gone away from the mask because in healthcare we're mandated. But I am very concerned about what's brewing in our community. So I have some reading material that if you do have trouble sleeping at night, this will assist. But it's science-based, it's fact-based, and I think it will be informative if it's something you're interested in. Thank you.
Do you have thoughts on vaccinated people and masks?
At this point, I think it doesn't matter. You can tell I'm vaccinated because on my badge is an orange circle, orange sticker. So in the health system, everyone who's vaccinated has this on their badge. And this is important to know because we deal with the public, and they are amused at times, not in a good way, when they're cared for by somebody who doesn't have the orange sticker on their badge. So I think everyone, regardless of vaccination status, should wear a mask at this point because the level of prevalence in our community is growing.
Have you received anything on critical access?
Yes, we are we have our critical access designation retroactive to I think it's June or July of 2020, in fact. So we're in good standing there. And it's in place until December 2023. And our project is slated to be completed December 2023. It's just funny how those things work out. However, prior to that, in the summer of 2023, we will go through our tri-annual Joint Commission Accreditation Survey. And that's what will drive our ongoing accreditation in the critical access program.
Jerry, was that a legislative fix or administrative, or where did it come from?
No, it was neither. I believe it's going to be an administrative fix because all 9 of us in the state of New York, if you went through accreditation, you were granted critical access status. And the normal cycle for critical access is a 3-year cycle. So the feedback I've gotten from the federal delegation is they will work this through in an administrative fix. And the administrative fix is addressing the definition of what's a secondary road and then our distance to Carthage.
But do you see it as being a permanent fix, at least as
Yeah,
far as
it
that
would
issue
be
is concerned?
yes.
Okay.
With the administrative, it'd be a permanent fix.
Okay.
Correct.
Greg, you had a question?
No, that was the question. Okay.
All right, thank you.
Thank you, Jerry.
Thank you, Jerry. Okay, moving on to county manager report, Ryan.
Oh, geez. Sorry.
Thank you, Mr. Chairman. To build off what Jerry was talking about, we reported at the Health and Human Services Committee last month, that we had received a $1.1 million grant for school reopening testing it's actually a CDC grant. We were hoping to use about $600,000 of that for reestablishing the Maple Ridge testing site 3 days a week like we had over the last year. So it'd be a Monday, Wednesday, Friday testing clinic. You guys have a resolution that was contingent upon the state accepting the grant. They've accepted part of our proposal, but not all of it. So folks that are not affiliated in any way with a school district in Lewis County will not be covered by the grant. So there's going to be a late resolution that Andrea and Tom and Larry and I have talked about that would propose that the county use some of our fund balance reserve to get that facility up and running and cover the cost out of pocket for non-school affiliated testing. So we can debate, you guys can debate that more when we get to it, but that's the story behind the late resolution that we're talking about today. We're hoping that the site will be open back at Maple Ridge by August 16th. There's a potential, that we could be sooner. As Jerry said, our COVID cases since the 26th of January have increased by 33. So, a week or so we've gone up quite a bit. So I think it's a good thing to try to push and get that testing facility up and running sooner rather than later.
No, since July 26th, right?
Yes, since July 26th, yep. We're getting a lot of questions about the Delta variant. The way it works is we send our samples to laboratories, state laboratories, and those samples are randomly pulled by the state for more detailed testing that reveals what type of, more specifically what type of variant the virus is. So at this point, we don't have laboratory confirmation that there are Delta variant, cases in Lewis County. However, Ashley's opinion, I'm sure if you ask Jerry, I know Dr. Arnie feels the same, it is very likely, considering 80% of all cases in the United States are of the Delta variant, that there is, cases of Delta variant in Lewis County, even though we haven't had, one of our tests pulled and confirmed. Because of the uptick over the last week or so, we are in a CDC designated zone at this point, which is called a substantial transmission zone. I think that it's important that you put that in context because the CDC is making their, these designated zones based solely on per capita numbers. So if you could give a little credit to the state, when they were doing their hot zones based on zip code, it was a much more nuanced approach. They were using hospital capacity, population density, testing capacity, all these types of things. The CDC's zone definitions is just purely based on per capita numbers. So yes, we have, on a per capita basis, a higher rate right now, but you've got to understand it's 27,000 people spread out over 1,200 square miles, not just, 27,000 people stacked on top of each other in apartment buildings and buses, right? So, context does matter with some of this stuff. Not to say that, we aren't increasing, because our numbers certainly are, but it is a little bit different when you put it in that context. Vaccination still remains the most important thing for Lewis County. That is, what we need to continue to push, continue to get people to, recognize vaccination in a medical sense. So our message continues to be, talk to their doctor, right? Shouldn't be a political decision, a social decision, should be a medical decision. We are running a clinic this Friday at Lowell Fire Hall from 2 to 4, and anybody can get a vaccine at any time just by walking in or calling ahead to public health. So We certainly have made vaccines available. During the fair last week, we did over 60 vaccines sprayed on site, which was, a great resource. The last thing, because of the CDC designated zone, that comes with a CDC recommendation, as Jerry mentioned, that masks be donned indoors once again for both vaccinated and non-vaccinated individuals. I was going to, it's great we got the board here today, so I would turn it over to you guys for debate, really focusing just on our own county facilities, if that's something that you wanted to pursue at this time, or, let things develop a little bit more, so.
I think if the CDC is recommending it, I know it's kind of difficult because the numbers are fluid and change daily, but we've gone along with CDC thus far. I would say to continue to go on with CDC guidelines.
Seems like everybody's got a different opinion on it, doesn't it? The doctors and all that, it's hard to understand who you should follow. So your assessment is the CDC is the one we ought to be following.
Yeah, I mean, I work in the hospital as well, so I've been wearing a mask, and I think that a little bit longer, especially if it's going to drive our cases down so the schools can open, because we're right on the brink of schools opening, and I hate for us to have our numbers go sky high and jeopardize that.
I think we should wait a week and find out if the spike continues or not. Because if you go by the way the governor set it up, we aren't in the same scenario as the CDC's way of thinking. I mean, our per capita is spread over 1,200 miles versus 27,000 people in one little community. So I think it's jumping the gun a little bit. I'd rather wait and see before we mandate out of our board that everybody has to wear masks. That's my opinion.
I agree with Greg. I'd want to get some input too from the department heads, especially DMD clerk, to see if they think, based on their experience, if they have any thoughts on it too.
If we wait a week, do we have to then reconvene a special meeting to change that?
No, we're talking exclusively about county facilities.
Okay.
So we're not talking about, you guys could talk about it, but it's in your authority, but what I was proposing was just about our county facilities, not other businesses, other, operations in Lewis County outside of our direct purview.
Are you proposing full-time masks?
I'm not proposing anything, I'm just saying
You
this.
said you proposed.
I just want the discussion because we're getting questions from the press and our employees about, we're in this zone, we're the only county in the North Country that's in the zone. Are we going to, go along with the CDC, or are we going to, kind of chart our own path?
Well, what would you suggest? I'll say it that way. Are you suggesting that we mask full-time within our facilities?
I think that this is a policy decision. I think that that's why we have the Board of Legislators, to make policy decisions. Honestly, listen, most of the time you ask me for my opinion, I'll give it to you. But, I think we've got to be careful, because I agree with Lisa that, the CDC, is a great source of information. I also think we're walking a fine line in our community of folks that are, already, have had it with some COVID stuff. We've done a good job in Lewis County of walking the fine line of bringing people along with us. I don't think we've swung too far in any direction. We're definitely going to have to tighten up coming into the fall. That's just math. With our vaccination rate, it's going to happen. The question is, do we do it at a rate that we bring people along with us so that they still, have confidence in the county government, or that's for you guys to decide, really.
Do we know what our percentage was when we stopped wearing masks compared to what it is right now?
No.
Good answer.
Sorry, no.
So,
Brian.
okay, so if we hold off a week Or if we hold off until we reach a certain number, what is that number that we pull the trigger on?
CDC's recommendation, it's numbered.
So if you're talking wear a mask within the county environment,
Well, my next thought was that we go back to wearing a mask in the halls, and if you're proximal to someone else
so
within
I
6
could go
feet.
shopping for groceries and find
This is
Lisa.
just in
Find
county.
Lisa or you, and you don't have a mask on. So what are we gonna gain by wearing a mask just here?
Good point.
You're indoors, close to other people.
Well, you would
You're
be
in the
shopping.
store too.
You are, but
But
if
not
you're
for 10
sharing it,
minutes.
and if you wear your mask here, you're not gonna give it to other people.
Brian, what do our public facing employees feel about it? Have you had any input on that at all?
Our employees are representative of the community as a whole, so we have some.
It's all
that-
over the map too, then. Okay, thank you.
You know, people adjusted their behavior just by looking at what was going on in the community. You know, and we know Walmart wasn't enforcing it. We know there were lots of places people weren't wearing masks. But when the numbers ticked up, they put the masks back on. And when the numbers came down, they didn't wait for the CDC to tell them what to do.
So when we go to church and they're not wearing a mask, and we come here and we are, I can't wrap my head around this because if we're gonna wear a mask, we should be wearing it all the time.
We're one of the largest employers, and a lot of times, you know, the stance that the county takes with our facilities, a lot of other organizations, particularly the not-for-profits in Lewis County, will follow us. So, you know, there's that as well.
This is a science show. What does the scientific, where's the science on it again? That, maybe you should care, there's some more information on that, I appreciate it.
Well, thank you, Sheriff, for the invitation.
Thank you, sir.
May I approach the table?
Sure.
To that end, I have printed materials for you. There are 3 things we can do to immediately impact the spread. Get vaccinated, wear a mask, and be socially distant. Now, and we've had some success, right? But over the period of time, vaccination rates have not grown dramatically. In many pockets, we're not wearing masks, such as here. And with that comfort, you are sitting much closer together than you were just 2 months ago. And that's being repeated. I appreciate your concern that there's inconsistency. We do it at the hospital. Would you want a hospital that isn't enforcing a mask mandate? I would think not. And just because not all are doing it, we teach our kids early, lead by example. And just because someone else isn't doing it doesn't mean we don't do it. This little piece of material will help keep you safe, and it will help keep your family safe, and it will help keep your neighbors safe. The science is in this material that I am providing you. States that have deviated from So, I think this spike, this increase that we're seeing, not only in New York State, but throughout the country, is directly related to vaccination rates and to the relaxing of the mask standards. Well, thank you.
Thank you.
Thank you.
I got plenty of it. Sure. Yes, sir. Well, thank you, we're very proud. Thank you.
So we have a policy in place for, unvaccinated people to wear masks. I guess the question is, where do we wish to go with the vaccinated people?
I guess the only question I have, if wearing a mask helps keep the infection rate down, I think we're better off, so I guess I wouldn't mind wearing one if they went that direction, it's no problem. But, we want to try to keep it as low as we can, make sure the kids get back to school. move this year too, everybody else, so.
Where are we at?
Did you say this is just to change the policy with respect to vaccinated people? What was the?
Because unvaccinated are meant to be wearing masks.
Unvaccinated people are supposed to be wearing masks now.
When they come into the building.
It's operated on an honor system, so we're not asking any documentation, but that is the current policy.
Yeah, Jake, go ahead. So I'm sorry, Mr.
Sorry, it's fine.
So to address Ian's question, I have talked to both staffs about this. We're in a unique position because, unlike a revenue deficit department, we're a revenue generating department. So both of my staffs, we kind of look at everything just a little bit different than everybody else. And basically, we view both departments as like a small business, okay? Because we generate revenue. I've talked to both staff, and we, all just kind of decided that, we had to wear masks for 16 months. We've taken them off, but if it is to keep both our offices open and to keep serving the public and to create, less of an inconvenience for our residents, for our departments and everything, then the staff members are, willing to do, whatever it takes to keep the buildings open. As far as the public, I haven't really gone down there for coming into the DMV. I do know over the past 16 months that, especially the DMV, we've had every situation thrown at us as possible, and we have every mechanism in place that I can control of who comes in the building, who doesn't come in the building, how we want them to come in the building, when they want to come in the building, and I can control the outflow and everything. And then with the security guard down there also, we have the means of easing the public and easing the staff in case someone gets upset of any new policy. I will say that for the DMV to go back to appointments, you're probably not going to see that happen, especially with the outdoor PA system and our number system. We have proven that it is far more superior, efficient, and we have way more control of how we can mobilize the building, that we're going to stick with that system so the public doesn't have to worry about appointments again. I don't know if that answered your question, Ian? Yep.
So, one other thought. As Jerry points out, if we were to return to masks for everyone in the hallways, and when you're proximal to a person within 6 feet, it may prevent an outbreak that could possibly happen and end up shutting our facilities down. There is that too. So, I understand that no one wants to return to masks, but the other thing is we could move back to masks, and if this thing spikes and goes away or drops down in a week, we can change the policy back. So, play it that way too.
It's not like we are deciding these masks. It's the numbers, it's the infections, it's nothing that the CDC is guiding us. It's nothing that we are doing. We're following the science if we ask us to mess up.
But the science that CDC is using is for a population that's in a closed area, not for, their guidance is not the same as what it is for Lewis County.
Yeah,
We're in
it's
a
not
unique
perfect.
situation.
Yes.
And they're using guidance for a congested population to try to control our population, which is, like I said, 1,200 miles in
I don't
circumference.
think it's a control thing.
I think it is a control
perfect,
thing.
and a mask is a pretty simple thing to
And if you don't have to wear a mask in Walmart or the church or the drugstore or the boutique or the hairdressing shop, why are we making our employees or anybody coming to our building wear a mask? I think there's plenty of distance here anyway. If
Okay.
you don't feel comfortable coming in here without a mask, then wear a mask. Should be your choice, not something we set forward.
Okay. Lisa, would you like to call a question, make a motion that we return to masks until the crisis passes?
Yes, I will make that motion.
Okay, do I have a second to that? Okay, any further discussion?
I'll,
Jerry.
I want to make 2 points, just as far as, I know we got to move on, but just as far as the general view on masking. I think we all accepted masking last year when we were really, we were in a bad situation. And early on when we weren't ready for it, in spring of 2020. Number one, as a matter of personal responsibility, it's a way of protecting yourself, it's a way of protecting others. I think that's true. There's science for it, there's good science that supports that. The other reason for it was because we didn't have a vaccine available. So I think that, there's an I guess both ideas go to the idea of personal responsibility. What do I owe to the community around me? Now, we have seen there is such a thing as breakthrough cases with the Delta variant, but places that have experienced spikes in cases have not seen a commensurate increase in the hospitalization rate. So that was the other issue, was if we are, the things that we do to protect ourselves are also about keeping our hospital in check, making sure that it can meet the needs of the community. Now, we've had, I think, is it 1 hospitalization so far? So, I would say that all of the stuff that we've asked everybody to do, unless we're going to basically take the position that this will be the position forever, because the vaccine ended everything. That you have the availability of a vaccine, there, you should get it. I think everybody should. I got it as soon as I could. Being a government employee, I still encourage everyone to do it. But I think that because there's a vaccine, it reduces the risk that you pose to the community. The moral aspect of personal responsibility that went along with all of those prophylactic measures like masking is suddenly diminished. That's my personal view on it. I'm going to vote no on this, with the understanding that it may be forced on us in a matter of weeks anyways. That's another consideration. It may just be taken out of our hands. But I'm not comfortable asking the community to go back on this.
And I'd like to add, for that variant, the breakthrough, the science has shown that it's the people who have been vaccinated are also immune compromised, also, the individuals.
Yeah, it's worth saying.
They have issues other than just,
Right.
a flu bug.
You're much better off being vaccinated, even if you're going to catch it,
Yeah.
because you probably, if you're immunocompromised,
You're gonna live.
Right, yeah, you're going to weather it much better.
If you don't want to get vaccinated, don't. It's your choice.
Okay, we ready to vote? We have a roll call, please.
Can we read the motion one more time so we understand all of it?
Sorry. I have down that legislator Verkler made a motion to change county policy for all employees and public to wear masks in county buildings. And then it was seconded by legislator King.
Okay, I think it was further defined that while they're in the public hallways and within 6 feet of another person, if they're sitting at their desk, they don't need to wear a mask, correct? And this is a temporary thing where if this spike drops down to, I don't have a number, then we can
Below the substantial transmission.
little substantial transmission, and we can return to mask-free for those that have been vaccinated.
May we also clarify this does not apply to county-owned healthcare facilities? It means that in the health system, we would continue to mandate masks.
Okay.
I think one one last point is, as I understand it, our public health director would be in favor of a motion such as this. Is that not correct?
Yes, Ashley would have happily been here tonight. I told her I could cover for her, but she did say in an email that she supports following the CDC.
Okay,
Okay.
all right, so, roll call vote. Legislator Hathaway,
Yes, unfortunately.
Legislator Burns.
No.
Legislator Chartrand,
I will listen to the public health director and I will vote no. Or yes, yes, sorry.
Legislator Kalzer,
No.
Legislator Osborne,
Yes.
Legislator Verkler,
Yes.
Legislator Gilbert,
No.
Legislator Morahan,
I don't know.
Will you abstain?
Legislator King,
Yes.
Legislator Dahlhoff.
Yes.
We have 6 yes and 4 no, so it passes.
Thanks, Ryan, for bringing that up. Great time.
That concludes my report.
Handle that easy, right?
Okay, if there are no more other questions for Ryan, we'll move on to the treasurer's report.
Thank you. Vaccinated with the following policy. You've received a written report, just a few quick highlights. As you can see, our sales tax receipts continue to trend well above our budget in 2021. That's a great thing. I added a little box on bed tax receipts, and we are also well ahead of typical pace in bed tax. Another good indicator for us.
How many delinquents have you got there?
I can't answer that exactly, but I think the number is about 2 to 3, and they're very typical delinquents that we work with the county attorney to follow up with.
Thank you.
I think 2 other notes that there were noted at their notes in the bottom of the report. We are planning to move ahead with our property tax foreclosure auction, waiting for the expected expiration of the state's eviction moratorium on August 31st. So assuming that expires, we will move forward, and we've actually selected a date of November 4th for that auction. And last note is that our ARPA funding, the $5.1 million that we've been allocated through the federal funding, we do have to submit a first report in the end of August, and we are working on that at the moment. We will be using some assistance from our audit firm, EFPR, to ensure we compile the right data that we have to supply for that. That's what I have for you. If there's any questions.
Is November 4th election day?
No. Good question. It's a Thursday.
Okay. We have a resolution in our packet appointing you to the Dank Board. I know you've had considerable experience working with the Dank Board. Do you have any goals that you would have to help the county?
I would say yes. I've been working with Dank and aware of their services for 15 plus years now, so knowledgeable about what they do. And I think goals is really just to represent our county well, and to ensure that we are benefiting from the services they provide. I mean, they are a regional authority serving Lewis, Jefferson, and St. Lawrence County, and to make sure that we're getting our value for what they provide us.
You see no instance right now that needs upgrading regarding our county and the relationship with Dank?
I believe that we have a good relationship with Dank.
Well, I understand that.
But there's certainly,
I'm talking the services, basically.
Just to do the best we can to advocate for anything else they could help us with. And, a couple of recent examples. I think there's been some recent news about their recycling facility that potentially was going to be in Harrisville. I think they've decided not to, move forward with the larger recycling facility. That's unfortunate, but so to be able to weigh in on that type of discussion, and what you heard about earlier on water services. I mean, Danny has a lot of expertise in water services. Could we use that expertise differently? I don't know. I'm not saying we could, but again, just to be an advocate to draw on their resources if it can help us.
Actually, Dank is doing the Diana Water
Mhm.
District. They're handling all the paper, they're handling what these gentlemen were suggesting.
Right. Yep. So again, there's a resource there. Does it make sense for us to access it? So I guess no real goals, Phil, but just I think my knowledge of the organization is relatively good, and hopefully I can use that to benefit us.
Thanks.
Anything else for Eric? Thank you, Eric. Reported the Finance and Rules Committee per Rule 7, Cassandra.
Thank you, Mr. Chairman. The Finance and Rules Committee reports that they have examined the claims presented for payment and the total amount of $1,427,477 and recommend that they be audited and allowed for the amounts claimed.
Need a motion, please? Lisa, second by Ron. Any discussion? All in favor?
Aye.
Anyone opposed? Carries. So resolutions, are there any resolutions that anyone would like to be pulled out of the slate so we can vote on it separately?
Chairman, I'd like to pull 187.
187, I believe Ian wants 170.
Yes. Thank you, Mr. Chairman.
Anyone have any others?
We have the 168, the audit of claims, and the late resolution we will do separately as well, which is 193.
Okay, need a motion to pass the rest of the slate. Dick? Bill? Any discussion? All in favor?
Aye.
Anyone opposed? Slate carries.
Okay, auditing and allowing claims in the amount of $1,427,477.
Moved by Lisa, second by Gary. Any discussion? Roll call, please.
Legislator King,
Yes.
Legislator Kalzer,
Yes.
Legislator Chartran,
Yes.
Legislator Burns,
Yes.
Legislator Hathaway,
Yes.
Legislator Berkler,
Yes.
Legislator Gilbert,
Yes.
Legislator Morahan,
Yes.
Legislator Osborne,
Yes.
Legislator Dolhoff.
Yes.
Resolution number 170 is a resolution amending compensation plan with reference to the district attorney.
Moved by Lisa, second by Dick. Discussion.
Is this a change of grade or anything?
This is the one that we had 2 slots, and whichever one she could fill, we were going to abolish the other one.
Oh, this is
So we-
abolishment.
Yeah. All in favor?
Aye.
I would abstain, Mr. Chairman.
Show Ian abstaining, and the motion carries.
Resolution number 187, resolution amending compensation plan with reference to the sheriff's office.
Moved by Ian, second by Jerry. Discussion.
Yes, the reason I wanted to have a discussion on this one is the sheriff is here tonight, and I don't know if he's got an opinion one way or the other, but we put in here that he's going to be authorized to fill this position. Has he been contacted and he's in full agreement with this resolution as far as we know? Sheriff, you familiar with it? This is this Copenhagen Central School District Special Patrol Officer.
Like you said, I listened to you, but I wasn't. Can you repeat that again?
we have a resolution that we're going to, we've come to an agreement with Copenhagen Central School District to provide a special patrol officer from the county by and through the Lewis County Sheriff's Department for next year. It goes on to state that this would be retired member of the New York State Police or Sheriff's Department or New York State Retired Correction Patrol or Probation Officer. Compensation is limited to the retirement and Social Security law, which is $35,000. And I just thought that we paid more than that for the other two that we have right now. So this one is that much cheaper, so that's the right amount, because it doesn't sound like a lot of money for a whole year.
They can only make, I think, 36,000.
35,000.
35. That's the maximum they can make.
So we feel we can hire somebody competent within that realm of salary, that's what I'm understanding. Yes, okay.
No. Dick, I was called up by Ryan and Caitlin about 2 weeks back. Was that correct, you guys? Okay. We had a discussion. I had an opportunity to talk to, not yet, to Mr. Collin, is it? Am I saying the name correctly?
Scott Connell?
Collin?
Scott Connell.
Okay. Anyways, I didn't get a chance to talk to him at all. So earlier today, I finally did. And he was explained to me by him that he was told by the county of this plan and thought that it might be the only thing that he has at this time to his disposal. But that is not true. This is what the county's proposing to him. The gentleman wanted a SRO, the same as South Lewis and the same as Harrisville has. And the county is not going to give that to him. They're not offering that up because they don't want to incur the expenses that it costs to have an actual police officer, not a retired officer. So that's where that's at, Dick, and he was not happy about that, but he said, what am I going to do? And I explained to him, I said, well, once again, the county's put this back on me to try to locate a retired police officer that can come to that job. Now, once again, I think what everybody doesn't listen at the times, like I said, a retired police officer is only good for 1 year. 1 year. If he does not get hired someplace after being retired for 1 year, he loses his police status for the state of New York. And we can't find people to come to Parks and Recs from other agencies, part-time retired police officers. We're having a hard time across the state finding just recruits alone to take the exam and become police officers anymore. So, unfortunately, if that's the only resolution or issue that they can help out the school was to give him a security officer, then that's what he's stuck with. But he is not, after speaking with him today, he's not, he's at a loss. But he'd like something. The problem with that is it's left up to me to try to find that person, and I can tell you, I will not find anybody for this school year for that. Now, I do have an SRO person that would be ready to go. That we do have. And a younger person that would be more agile, much more adept at doing the job. And you can roll your eyes when I say that, man, but that's the truth. You need people who have the courage to do the job. And you need people that also need to have the ability to understand the youth that are sent to training also as well. And a security officer doesn't have any of that training as an SRO.
My understanding is that Scott Connell is perfectly happy with a special
Well, then
patrol
maybe you should
officer.
call him back this afternoon and see.
I believe there was a conversation that was had with
Sheriff, Mr. Pichet and we spoke with him on the phone, and he was fine with the position when we explained its duties and responsibilities to him. Really, from our position, the only difference is you're looking at a retired officer versus somebody who is currently who's currently a deputy. And when you're looking at a difference of $112,000 versus $35,000, it's a no-brainer from a fiscal standpoint. And he was fine because he saw that the school would be saving a considerable amount of money, since the school's portion of that is $62,000. So even if they're paying the whole amount, they're looking at close to half of what they'd be paying normally. I think it's worth making a shot, see if we can find somebody. And they don't have to be retired sheriff. They could be New York State trooper. They could be a corrections officer, parole, or probation.
Don't worry, they just explained to you that people aren't coming for this job. They're not coming to it. Sure. I mean, you know, I think if you pay a little more attention to the current situations out there, common sense wise, it's right there as a nose in front of your face. This is across the country, it's across the state. We are not finding people.
When you when you said you wouldn't find one, does that mean you wouldn't try to find one, or you?
Exactly. Did I say I wouldn't find one on purpose, or did I say that I can't find one? I think what I said was, you know, we'll do our best. I always do my best to find something.
Okay.
But like I said, sir, they're not knocking down our door to take this job anymore.
I get that, but I just wanted you.
I think the undersheriff explained that to you as well not too long ago. Am I correct on that?
I just wanted you to say that, you know, you would try.
Sir, I will always try. That's what I do for this community.
Thank you.
You got it.
Any other discussion? All in favor?
Aye.
Aye.
Anyone opposed? Motion carries.
Larry, you should explain to the people that if that security officer for that school is hired, would you explain to the public that I can't use them for Parks and Recs, correct?
That is correct.
Okay, thanks.
They will only be working this school year, and that's why there's such a
Yep.
saving.
Okay, thank you.
Resolution number 193, resolution to appropriate funds, Public Health Department.
Moved by Lisa, second by Andrea. Discussion. Well, did you have a question on this you wanted to talk about?
I have a question on that.
Okay.
With this $250,000, how long is that gonna last? Does anybody have a prediction?
Well, Ryan and I talked about that, and this is a starting number. Hopefully, we don't hit this number, but if we do, then we'll have to replenish it.
That doesn't answer my question. How long do you predict this to last? Is there a prediction, 6 months, a year?
There is no prediction we're even gonna hit it.
Yeah.
This is to pay for testing. Because of
How much?
what you explained.
I'll ask Jerry, about how much does it cost to run that Maple Ridge 3 days a week during that time, during the day frame?
So, Greg, the state is gonna pay for the operation and the admin. This only covers people that are not in the school system that go there to be tested.
Right.
It's
All the
60
ones in the,
It's $65 a test. Last year to year, we did 11,000 tests at Maple Ridge. So it all depends on what percentage of those, how many will we get now, and what percentage of those were affiliated with schools. So
I was just asking as a ballpark, do you think this is are we gonna have to come back up with more money?
the goal would be that, I believe, as we get into the fall and we have more instances of COVID, I think there will be more state and federal funding for testing. So this will allow us to get off the ground with the hope that the state or federal government supplements us at some point. If they don't, then it could potentially be a starting point. We might need more. Yeah.
Simple question.
we good?
Yep.
All in favor?
Yep.
Opposed? Carries. Other business, proclamation, Cassandra?
Proclamation commemorating August 7th as Purple Heart Day in Lewis County. Whereas the Purple Heart is a combat decoration and our nation's oldest military medal, first created by General George Washington in 1782. And whereas the Purple Heart Medal is awarded to any member of the armed forces of the United States who, while serving under competent authority in any capacity with one of the U.S. Armed Services, has been wounded or killed by enemy action. The heritage the medal represents is sacred to those who understand the price paid to wear it. And whereas nationally, Purple Heart Day is observed on August 7th each year as a time for Americans to remember and honor the brave men and women who were either wounded in battle or paid the ultimate sacrifice with their lives. And whereas the people of the County of Lewis have great admiration and the utmost gratitude for all the men and women who have selflessly served their country and this community in the armed forces, and who paid the high price of freedom by placing themselves in harm's way for the good of all. And whereas the contributions and sacrifices of the men and women from the County of Lewis who served in the armed forces have been vital in maintaining the freedoms and way of life enjoyed by our citizens. And whereas the many citizens of our community have earned the Purple Heart Medal as a result of being wounded or having lost their lives as a result of combat with an enemy force, construed as a singularly meritorious act of essential service. And now therefore, I, Lawrence L. Dahlhoff, Chairman of the Lewis County Board of Legislators, hereby proclaims the County of Lewis as a Purple Heart community, designating August 7th of each year as the day to remember and recognize veterans who have received the Purple Heart Medal, and honoring the service and sacrifice of our nation's men and women in uniform who were wounded or killed by the enemy while protecting the freedoms enjoyed by all Americans.
Thank you. Do we have any other business? Dick?
Larry, I'm confused on a couple of things here with these resolutions then. Because Resolution 178 said that we were going to get $1.1 million to establish COVID screening and testing and stuff. So I assumed that the $250,000 was coming out of the 1.1. But is that the money that Jerry referred to that has been changed and canceled now and it's not coming?
Correct. So the state did not approve, we wanted $611,000 for the Maple Ridge testing. The state only approved the overhead, staffing, and tests of school personnel and school affiliated people. We still want to offer testing to everyone in the community, so we're willing to pay for those other non-school affiliated tests at $65 a piece out of pocket.
What happens to 178? That's a non-issue anymore then.
No, we're still entering an agreement with the state for that grant. It's just the budget that we submitted was altered.
Okay.
Mr. Chairman, I have one more question. I know Greg and I touched briefly on the issue with the Delta variant and possible breakthrough cases. Do we know currently, I mean, one of the things with this is just why it's so important to have a high vaccination rate in the community, because it reduces spread. But now that there's a possibility vaccinated people could catch it, that was bragging before. Do we know what the numbers are as far as the breakthrough cases in Lewis County?
Can we track that? I don't know if we...
We do know that there are currently about 12 active breakthrough cases, but 6 of those are associated with immunocompromised individuals.
Are any of them hospitalized? Do you know
I don't know that. So Greg mentioned it earlier, but even when you get the shot and you have immunocompromised issues, your body isn't reacting to the antibodies the way that it should. So when you encounter the real COVID in nature, your body isn't as prepared. So
but much better prepared than
much better.
Yeah. Okay. Thanks, man. Appreciate it.
I'd like to remind everyone that the September meeting will be held at the West Line Fire Hall at 5 o'clock. Do we have any other business?